This segment is brought to you by the Southeastern Spine Institute. Welcome to Southeastern Studios, where we learn about the latest in medical technologies and sit down with physicians who are prominent in their field. All right, I'm joined again today by Dr. Tim Bryan from Southeastern Spine Institute. How are you doing?
I'm doing great. How are you?
Wonderful. Now, I've been hearing a lot about minimally invasive surgeries. What is it? Tell me about it.
So yeah, you'll see a lot about minimally invasive surgery if you look online or see on television. So smaller incisions with less blood loss, less soft tissue damage with splitting muscle as opposed to cutting muscle. That translates into shorter operative times, so less anesthesia, less pain post-operatively, and usually a quicker return to patient's lifestyle.
So this is not only important for you guys, but also the patients.
That's the big thing that you see. Back when I was in training, we were doing lumbar fusions, doing them open with more blood loss and longer hospitalizations. Most of those patients were in the hospital for 3 days. Now we're getting patients out typically within a day.
Wow.
So it's a big change for them, getting back, getting out of the hospital, getting them moving quicker, and they just do better and feel better when you can get them moving faster.
So let's talk about the ways that you can actually cut back on how invasive these surgeries are. Are you using robots? Is it different tools?
Sure. Most of it's doing smaller incisions. So you're doing a smaller incision, which translates into less pain post-operatively, less blood loss, and usually through like tubular access. So using a tube that you can actually work through instead of a big open incision with big retractors. So those are the way things are going. And including with that, minimally invasive is going on to robotics. It's been quite a big advancement lately. So what you can do is you can get preoperative before surgery. You can get imaging with MRI and CT scans and build a three-dimensional picture that you can then combine with robotics to assist with the surgery and plan the surgery preoperatively on this 3D model you've created from the imaging that you've obtained.
What would you say is the advantage of being able to get your surgery done here at Southeastern Spine?
The advantage is avoiding the hospitalization, so we can get you into the ASC, we can perform a procedure, and oftentimes you can go home the same day without a hospitalization.
Now, I think a lot of people might be a little bit hesitant to come to the doctor to get some of their problems treated if they're having pain because they might think that they have to get surgery. Is that always the case?
That is not. In fact, the vast majority of our patients we're able to treat without surgery. Most of the time, it depends on the severity of these symptoms. So some patients have sciatica down the leg, not so bad, it's manageable, it's only been on a short period of time. Sometimes we can treat those patients non-operatively, so without surgery, doing a combination of physical therapy, medications. Sometimes it comes to doing an injection that can be helpful. There's a lot of options before you even get to surgery. Surgery is usually the last resort. Some indications, sometimes someone comes in with such a bad problem that there is no other option and they need to have surgery, but the vast majority of patients we can treat without surgery.
And that's one of the benefits of Southeastern Spine is that you guys have all of those types of doctors and specialists underneath the same roof.
Correct. That's one thing that we pride ourselves on here at Southeastern Spine, the fact that everything's in one building and we can get the patients through quickly to get an answer and sort out their problems. They're not having to go over here to get an x-ray, go over here to schedule an MRI with another facility that may take weeks. And the fact that we have a multidisciplinary approach with physicians in conservative care, so non-operative physicians and surgeons working together to take care of our patients.
Why do you think it's important for people to not wait when they're experiencing pain?
They don't need to wait. The longer you have a neurological deficit or a weakness, so that's something you want to get addressed soon. When you have pain traveling down the leg with weakness, that needs to be looked at quickly so you can determine the cause of the weakness and the pain and get that sorted out sooner than later.
Thank you for joining us for another segment from Southeastern Studios. And as always, you can go to southeasternspine.com for more information.